Thank you, Mr. Chairman. I urge my colleagues to support H.R. 6313, the Responsible Additions and Increases to Sustain Employee Health Benefits Act of 2018, which was introduced by Representative Steve Stivers and of which I am proud to be a co-sponsor. I want to thank Mr. Stivers for all the work he's done on the vital bill that would allow balances in flexible spending accounts, or FSAs, to be carried forward each year. FSAs are employer-established accounts that allow employees to set aside pre-tax dollars to cover deductibles, co-pays, and co-insurance, as well as qualified medical expenses that are not always covered by health insurance. They're an important part of a family's ability to save money for critical medical services. From their inception, FSAs didn't have any restrictions on the amount families could save in these accounts. However, after years of legislative and regulatory fiddling, FSAs are constrained by two illogical rules. The use it or lose it rule blocks families from carrying over their full FSA balance from one year to the next and encourages them to spend excess funds whether they need the service or not. Ending this rule could have a positive effect on overall spending, including keeping premiums lower through utilizing fewer services under their health plans. Additionally, Obamacare placed a cap on contributions to FSAs, which is currently at $2,650 in 2018. This prevents families from building up a better backstop in case of unexpected medical expenses that their insurance plan didn't cover. And it discourages flexibility and consumer choice in our healthcare system. We should be giving patients more control over their healthcare decisions, not less. H.R. 6313 repeals the use it or lose it rule and allows balances in FSAs to be carried forward each year, giving families the ability to protect themselves from unexpected medical bills. By allowing them to roll over their unused funds, it will incentivize consumers to only purchase what they need, ensuring more economic efficiency in the healthcare system. I urge my colleagues to support this common sense bill to give families more flexibility in paying for medical expenses, and I yield back the balance of my time.
The gentlelady yields back. Will now proceed to consideration of H.R. 6313 without